successfully. The numbers are quite sobering. We've had over 135,000 deaths in this pandemic for the United States. We have over 3 million cases. If you look globally, there's close to 600,000 deaths and about 13 or 14 million infections. So this is a pandemic of historic proportions. I think we can't deny that fact. It's something that I think when history looks back on it, it'll be comparable to what we saw in 1918. The situation that is the current challenge that we're facing right now is the resurgences of infections in the south and southwestern part of the country, but particularly in areas like California, Florida, Arizona, and Texas. They're seeing record numbers of cases, mostly interestingly among young individuals, strongly suggesting the link between attempting to open and in many respects, as we saw pictures of and photos and films of, is that, and I will get back to this in a moment about responsibility, where individuals, mostly young people, were seen at bars, congregated in crowded places, many of them without masks, which really adds fuel to the fire. So our challenge today and tomorrow and next week is to try and contain these outbreaks and get us back on the track of being able to not only contain, but also to open safely. So bottom line, it's a global serious situation. It's a serious situation in the United States. The United States being a very large country and very heterogeneous, both geographically, demographically, and other ways, it's a mixed bag. Some areas of the country are doing really quite well, and others are being challenged, as the states that I just mentioned. You said to compare it, and I'll do it briefly. Right now, if you look at the magnitude of the 1918 pandemic, where anywhere from 50 to 75 to 100 million people globally died, I mean, that was the mother of all pandemics and truly historic. I hope we don't even approach that with this, but it does have the makings of the possibility of being, approaching that in seriousness. Though I hope that the kinds of interventions that we're going to be and are implementing would not allow that to happen. But it does have strong similarities with that, in that it was the emergence of a brand new infection. That was influenza. This is coronavirus that, essentially thrust itself on the human population and had two characteristics that are the thing that make it, as I say, the perfect storm. And that is a virus that jumps species, but that almost immediately has an extraordinarily capable and efficient way of spreading from human to human, simultaneously with having a considerable degree of morbidity and mortality. And that's what we're facing now. And you asked me to compare it with other outbreaks, and I think I could give you examples of each of those, and I'll do it very quickly, that had one or the other of those characteristics, but not both. And that's what I refer to when I say the perfect storm. So let's take the threat of the bird flu that you and I had a lot of experience when you were in the department. And that is the H5N1 and the H7N9. It jumped from a chicken to a human. It had pre-pandemic potential. But what it didn't do, it didn't spread from human to human. So if you were unlucky enough to get infected, you had a 35, 37, 40% mortality. But it was a dead end mostly with humans. It didn't go from human to human. Then you had the situation with the 2009 H1N1, which was very efficiently transmitted from human to human. But pathogenically, it was a weak virus. I mean, the deaths that year were less than with a seasonal flu. So you had the two ends of the spectrum. One transmitted well, didn't kill. One killed, but didn't transmit well. And what we have now is a virus that is very capable of spreading from human to human. And even though it has a wide range of impact, from 20 to 40% of the people who have no symptoms to individuals who get moderately sick, very sick, serious enough to go to the hospital, serious enough for intensive care, ventilation, and even death. So it's a very unusual virus in that the range of severity is so great and wide, which actually leads to confusion on the part of people as to whether this is really serious as some people say it is. Well, it's not serious for some people, but it's deadly serious for others. So I'll stop there, and that's kind of the overview.
No, that's incredibly helpful, Tony. And really my follow-up is, because I think the virus has this disparate impact, as you've described, there's some issues in the public debate now that would be really helpful if you could help clear up. I mean, one would be, there is this discussion about whether a rise in total U.S. cases is a result of testing alone as opposed to the disease progressing. And two is, should we take comfort that death rates are declining, which they are, even as infection rates increase? And then this recent discussion about the ability of the virus to spread through aerosolized form versus the droplets. And if you could just, those issues have been coming up regularly. If you'd be able to help us understand what the science shows us.
Yeah, okay. So first, hang on, I want to write down your questions, John.
Okay.
Okay, so sorry, I was distracted with that. So the first question is this just an increase because of testing versus an increase? Well, there's no doubt that it's both. I mean, obviously, the more you test, the more you're going to pick up. So increase in testing is going to give you increases, but there is no doubt that there are more infections. And we know that because the percentage of cases, of the cases that are tested that are positive, is increasing. Therefore, unequivocally, you're seeing truly more new cases. In addition, we're seeing now more hospitalizations, which lag behind infections. And we're starting, and we'll see, though not as much as we've seen, very likely more deaths. So clearly there are more infections. The second question is,
I think you hit it, which is really, should we take comfort that death rates are declining? Even
okay, so we've got to be careful, because remember, the big spike in the death rates that we saw was the terrible situation that they went through in New York City metropolitan area, in situations in Chicago and New Orleans and Detroit. And that death rate, happily, is going way, way down. What will happen is that we will likely see some more deaths as people get hospitalized, but I doubt, John, that it's going to go up to the extent that we've seen before, mostly for a couple of reasons. One is that if you look at the age range of the individuals who are getting infected now, as opposed to early on a few months ago, it's about a decade to a decade and a half younger. So even if young people, which some do, get sick enough to get hospitalized, it is highly unlikely that the death rate among them are going to be at the level of the death rate of what we saw in the real core of the explosion that we saw in the northeastern part of the country.
And then the last, really, the other question that's been in the debate is the extent to which the virus is transmitted through aerosol.
Yeah, that is still debatable, John. In fact, 2 minutes before I came in, I just read a summary analysis of it. And there's almost certainly that there is a degree of aerosol occurrence. The degree of transmission, aerosol-wise, is very unclear. Most people think it is not the dominant modality of transmission, but the definitive proof has not been put. I don't think it's dominant. I think it actually occurs. And for those listening to know the difference, is that droplet type of transmission rarely goes beyond 6 feet. So if you cough, sneeze, or even talk, a droplet would tend to drop to the ground, which is the reason for the 6 feet limit that we talk about staying away. When you have aerosol, it's in a droplet that's less than 5 micrometers, which means it has the capability of floating around. So you would expect that it does have the capability not only temporally of floating around, but getting behind the mask, around the mask, or in the mask. So that's what they talk about with aerosol.
I mean, that's very helpful. I'm going to turn this over to Mo now for the next question.
Hey, Dr. Fauci, thanks again for joining us today. Let's turn to the response a little bit now. As we've already talked about, the disease has hit the United States harder than many other nations around the world. And as you talked about, it's not entirely just because of testing. And so starting big picture first, how much of that do you think has to do with some of the nations that have dealt with this maybe a little bit more effectively have had more of a coordinated national response, whereas we have opted for more of a state-based or local or regional response here in the United States? Is that part of the disparity? Can we even have a coordinated national response in the United States?
Mo, it's always easy to look back and say, if we had done this, would it have been different? I mean, that's always where, and that will happen when this is over and people will, I'm sure, analyze it every which way. Some of the things that I believe have an impact on the differences, and I don't think we can fully explain it, is that in Europe, for example, and in some of the Asian countries, when they shut down, essentially locked down, they locked down to the tune of about 90+%. They really locked down. We have a very large and a very heterogeneous country with different risks in different places geographically and demographically. And in reality, even though we locked down considerably, we only locked down, the estimate is somewhere around 50-55% or so. So when we had the outbreak, and in Europe, they went up, they peaked, and then they came right down to baseline. They really did go down from thousands of infections to handfuls or so of infections. Whereas in the United States, if you look at our curve, for better or worse, we went up, we peaked, we came down, and we never really came all the way down to baseline. We stayed around 20,000 a day of new cases until the most recent surge, when we went to 30, then 40, then 50, and then 60. So the issue is, we never got down to the baseline so that when you started to open up, you had relatively few amounts of infections to deal with. Whereas when we opened up now, you're seeing the surge. The reason for that are complicated, Mo, and there are many. The issue of how one does a response, we live in a country that from its founding had a federalist bent to it, where there were states that had the independent right and capability of doing things their own way. In many respects, that works to our advantage in other situations. Possibly, that really was a little bit of a disadvantage here. Very difficult to make a definitive comment about the contribution that paid for the difference between what we see here and what we see in Europe.
Okay, I'm going to toss it over to John. We all have so many more questions. We're going to try to get through John and mine as quickly as possible before we go to the students. And this is just a reminder to the students, you can still continue to submit your questions using the Q&A tab at the bottom of your Zoom screen. John?
Great. Tony, speaking of schools and students, many schools around the country are announcing their guidance for the fall. We have at Georgetown. But just yesterday, the LA County and the San Diego County public schools announced that they would be online for the entire fall. The president and many others have been talking about reopening schools, full reopening as quickly as possible. The CDC's issued guidance describing steps that schools can take to open safely. I guess what I'd love for you to do is step back and just help us think about how should schools approach the upcoming academic year? And if you could clarify what we know now about the risks of children, teenagers, and young adults across that whole age cycle from K through 12 through higher ed, and the risks that they present among themselves, but also with teachers, staffs, and their families. What's the right way to think about this as schools go forward?
Okay, so let's, John, for clarity, let's just talk about, elementary, middle, high school, and not university, because there are major differences there. And we could get into universities later, but I think people are much more focused on school. So I start off with a general principle and then work your way towards the operational aspects and the exceptions. So as a general principle, we should try as best as possible to keep the children in school for the reasons that the unintended downstream ripple effect consequences of keeping the kids out of school and the impact on working families and on other aspects of society can be profound, not to mention the negative effect on the children. So as a principle, we should try as the default to get the kids to stay in school. However, that's going to vary from where you are in the country and what the dynamics of the outbreak are in your particular region. So that's the reason why, although the fundamental principle is there, the one other guiding principle that is overriding is the safety and the welfare of the children and the safety and the welfare of the teachers. So you've got to take that into consideration. So if you're in the part of a country where the dynamics of the outbreak are really minimal, if at all, then there's no problem at all in getting back. If you're in a situation where you're in outbreak mode, then you leave it up to the local individuals, as you've said in certain California schools, certain Florida schools, of making a decision based on the judgment of making sure that safety of the children and safety of the teachers are paramount. So you guide the principle, let's try and get them open to the extent that we can, but let's take a look at the dynamics of the infection in the area that you're in.
Thanks, Tony. Thank you. Mo?
This maybe is a little bit more, less about the response from the government, more about the response from citizens. Look, I'm glad you're here, and I'm glad you're speaking out. And I'm glad that you are giving students a chance to talk with you, because a lot of people are confused right now about the state of the pandemic and what they should be doing. My wife and I every night sit down and try to figure out what we're allowed to do with our kids based on, we're comparing different news stories we've read or different pieces of guidance that we've picked up. And I think a lot of the confusion can probably be attributed to three main issues. One, the evolving nature of the pandemic has resulted in more information and new information and evolving guidance. Two, a growing body of deliberate misinformation and disinformation that's being spread, much of it online. And three, the polarization and growing politicization of the discussion of the pandemic, right? I mean, just even this past weekend, the White House pointing to some of your previous comments in order to question some of the guidance. So my question is this: given all of that, misinformation, disinformation, evolving guidance, increased politics in the conversation, how do people synthesize all this information in order to make the right decisions? How do they know who to trust?
Mo, that's a good question. And it's difficult, to give you a definitive answer, except that for the most part, I believe, for the most part, you can trust respected medical authorities. I believe I'm one of them, so I think you can trust me. But I would stick with respected medical authorities who have a track record of telling the truth, who have a track record of giving information and policy and recommendations based on scientific evidence and good data. So if I were to give advice to you and your family and your friends of your family, I would say that's the safest bet to do, to listen to the recommendations from that category of people. But it's entirely understandable how the public can get mixed messages and then get a bit confused about what they should do.
Let me ask one quick follow-up before tossing it back to John. You just mentioned data. And there was a story that broke literally moments before we convened here today about bypassing, that data collection will now bypass the CDC and go straight to HHS. And I'm wondering if you had any thoughts on that sort of late-breaking news.
No, Mo, one of the bad ideas about commenting on late-breaking news that you didn't read, that's a surefire way to shoot yourself in the foot. I think I'll pass on that one.
Fair enough. Fair enough. right, we're going to go to John, and then after that, right to student questions, which will be probably better than any of John or my questions.
Absolutely, and I think my last question as we start to queue up the students, Tony, really is, and I know we asked a lot of questions, but it really does so far get to the complexity of this experience the country is going through. But most of the people on this webinar are students, and they're young adults. And I guess as we start to bring people on, I'd love to ask you to say, given what we know now, given everything we've talked about, what is your message to young people, young adults, teenagers? As more states open up, some are pausing, but really focusing on sort of what are the risks and the responsibilities of young people as we approach the pandemic, where we are right now, given what we know.
Well, thank you for that question, John. I was hoping someone would ask it, because I think it's key. It's really key to what is going on right now with the resurgences that we're seeing in some of the southern states. And I say this with some trepidation because I don't want to seem preachy about it. But since right now, if you look at what's going on in the country, that the infections are among young people, very likely contributed, at least in part, to what you're seeing on TV of young people gathering at bars, crowded places, congregating, many without masks. There is an understandable situation where a young person could say, statistically, the chances of my getting into trouble by getting infected are much smaller than an elderly person and a person with an underlying condition. And since I, as a young person, am really quite healthy, it doesn't matter to me. I'd rather be there sipping my margarita at a bar in a crowd. Well, but the chances are you're going to infect someone who then will infect someone who then will be a vulnerable person who could get sick, who could get hospitalized, who could even die. So not only are you propagating the outbreak, but you're actually putting other people in danger. So I would hope you could appeal to the young people to not only take the individual personal responsibility, but think about your societal responsibility. And that's what I mean when I say we're all in this together. Everybody has a place and a role in getting this outbreak under control. And you're not caring whether you get infected or not is not a good way to get the outbreak under control. To get it under control means you don't let yourself get infected and you don't spread to anybody else. And again, I say that with some trepidation because I'm not blaming anyone, and I think people do this innocently. They don't mean to be part of the problem, but inadvertently, they are a part of the problem. And that's the message we've got to get across.
Thank you, Tony. Thank you very much. And so maybe I'll turn this back to Mo because we're going to be able to bring in some student questions here next. So let me do that.
All right, we've got a lot of questions. So Dr. Fauci, we're going to try to get through them, as many of them as we can. Our staff will notify students when we are ready or getting close to being ready to call on you. When we do, make sure you are, as we say in the business, broadcast ready, because you're going to be up on screen asking Dr. Fauci your question directly. When we call on you, make sure you introduce yourself, tell us who you are, where you're zooming in from, your school year, field of study, so that Dr. Fauci has a little bit of context. And so with that, our first question comes from Varsha Manan. Varsha, introduce yourself.
Hi, Dr. Fauci. Thank you for coming to speak with us today. My name is Varsha, and I am a senior in the SFS, School of Foreign Service, majoring in International Political Economy. And I'm currently zooming in from Plano, Texas. So I'm in a COVID hotspot at the moment. And I guess my question has to do with like what young people can do to contribute to depoliticizing this pandemic. Because I feel like a lot of this pandemic has been like controlled or like been impacted by politics. So I was just wondering what young people can do to kind of make it more about science and less about politics.
Well, I mean, obviously that's appears to be a simple question, but it's a complicated situation that you're asking about. It's very tough for young people to have an impact on depolitization, except by not being part of the politicization. In other words, this is a pandemic. Keep reminding yourself and your peers that this is something in which it doesn't matter who you are or what you are, you're Republican, Democrat, anybody else, we're all in this together. And the way you can do that is by fortifying each other in what you can do to essentially be part of what I just said. Protect yourself. The best thing you could do is protect yourself and fortify your colleagues in their attempts, hopefully successfully, to protect themselves from getting infected. The way to squash out an outbreak is to have not anybody get infected. So you're not getting infected, Varsha, is a big contribution to what we need to do. So hang in there, do your thing, and don't get involved in any of the political nonsense. That's a waste of time and a distraction.
All right, thanks for the question, Varsha. Next up, we've got John Fig. Excuse me if I'm mispronouncing any of the names, but John, introduce yourself to Dr. Fauci.
Hi, Dr. Fauci. I'm John Figge, and I'm coming to you from Bryn Mawr, Pennsylvania. I'm a rising junior in the School of Foreign Service. I'm a global business major, and my question: what kind of studies can we do right now in the middle of the pandemic about masks and transmission of the disease? Or are we just relying on anecdotal evidence because we're not able to do those kinds of studies right now?
You know, that's a good question, John. Right now, if you look at the meta-analyses, and there are pretty good studies of meta-analyses about the efficacy of masks, both for preventing you from infecting someone else as well as someone else infecting you, are pretty good. I would not want to do a randomized controlled study because that would be having people not wear masks and see if they do better. Right now, I'm convinced enough in the summation and I would say the totality of the data that has been analyzed by meta-analysis that I'm convinced that the benefit of wearing a mask clearly is there and is better than not wearing a mask. And I think to do this study would be kind of difficult to do because then you'd have to tell people not to wear masks, and I'm not about to tell them that.
All right, John, thanks for the question. Next up, we've got Caleb. Caleb, go ahead and introduce yourself.
Hi, thank you, Dr. Fauci. I am Caleb. I am a senior in the School of Foreign Service, currently zooming in from Washington, D.C. My question is on the World Health Organization. So the Trump administration has criticized the WHO and has also submitted plans to withdraw from the organization. How do you believe the WHO has done in terms of coordinating a global response to the pandemic? And what are your thoughts to the plans for withdrawing?
Well, Caleb, I mean, obviously this is a complicated situation. Of the National Institute of Allergy and Infectious Diseases. They are an imperfect organization, They have made mistakes, but I would like to see the mistakes corrected and for them to be much more in line with the kinds of things that we need. There are some very good people at the WHO, including the Director General, who I know very well. And I have a lot of colleagues that I've interacted with over the years. So I hope this kind of tension between the United States and the WHO somehow or other ultimately gets settled in a favorable way, because the world does need a WHO for outbreaks like this, and even for the general health of the globe to coordinate it. So I hope this thing gets resolved in a way that we find that's all favorable.
Caleb, thanks for the question. Next up, we've got Andrea Hobby. Andrea, go ahead and introduce yourself.
Hello, my name is Andrea. I'm from Bethesda, Maryland. I'm a current graduate student in epidemiology at Georgetown University. And my question is, Dr. Fauci, what is the best way, I guess, maybe, or policy solutions to defray the cost of testing as schools reopen? Because I know a lot of schools, they would like to do testing for like all students when they come back, and it's just an enormous cost in addition to the current like financial losses they're having.
Well, you know, I don't really have a good answer for that, because I mean, when I start talking about money and costs, I'm out of my area. You want to talk about other things, I'd be happy to do it. You know, a lot of the testing can actually be free of cost. So depending upon where you are and what you're doing. So there are many things that have to do with testing and even treatment of COVID that really is without cost. Since I'm not as familiar with it, Andrea, as I'd like to be, I would refrain from making comments, because, as you know, that often gets one into trouble. And I occasionally like to avoid that, right?
Thanks, Andrea. Okay, next up, we've got Claire Cushman. Claire, go ahead.
Hi, thanks for taking my question. I'm Claire. I'm a rising junior in the college studying psychology and economics, and I'm zooming in from the Boston area. So my question is, can you outline some of the reasons from your perspective and expertise as to why the COVID-19 pandemic has disproportionately affected poor communities and communities of color? And more importantly, explain what the federal government should do to mitigate these inequalities, especially in the event of another global health crisis in the future?
Yeah, well, great question. I'm glad you asked it, because I was hoping someone would ask it. So if you look at minorities communities, that's African American, Latinx, in some respects, Native Americans and Alaskan Americans, there are two areas in which they find themselves disadvantaged. The first, though one does not like to generalize, but as a general demographic group, minorities find themselves, because of their economic and employment situations, in a situation where it's less easy for them to protect themselves from getting infected. They have less of a chance of sitting in front of a computer teleworking, as opposed to being outside with jobs that require exposure. So their chances of getting infected are greater than the general population. That's disadvantage number one. Disadvantage number two is when they do get infected, given the social determinants of medicine that have been around for so long, they have a much greater incidence and prevalence of comorbidities, which lead to a poorer outcome. Diabetes, hypertension, obesity, cardiovascular disease, those kinds of things which put them in a higher risk category. So it's what you call a double negative whammy that they get. What can we do now, and what can we do in the long run? What we can do now is concentrate resources in the areas where they are demographically overrepresented, so that they could have easy access to testing, better access to health care, so that if and when they do get infected, they can get into proper care early enough to maybe mitigate some of the negative consequences. That we can do now. The longer range is, do we have a commitment, which I hope we do, to eliminate health disparities, which is a decade-long commitment. You're not going to do that overnight. There are so many things that you can do to modify the reasons why they have more hypertension, they have more diabetes, they have more obesity. So we can do stuff now, and we can make a commitment to do things in the long run.
Thanks, Claire. Okay, next up, we've got Dominic Gordon. Dominic, introduce yourself.
Hello, my name's Dominic Gordon, and I'm a freshman in the School of Foreign Service. I'm just going to enter my freshman year this year. Now, I know it's some boring things about foreign policy because School of Foreign Service, but I had a question about how international relations affects our ability to contain pandemics, and how greater cooperation amongst nations could help us prevent a second pandemic or a future incident. That was my question. And thank you for your service, Dr. Anthony Fauci. Fauci, you don't know how amazing this is to speak to you.
Well, it's my pleasure. It's nice to speak to you, Dominic. So you really bring up a very important point. The word pandemic almost answers your question, because pandemic means all. So it is essentially is global. So if you're going to talk about identifying, responding to, and containing pandemics, you've got to think globally. You can't think in a vacuum of your own country. So international relationships, trust between countries, transparency, agreements to have things like global health security network, which we try to have, those are all critical to an adequate response. And we have so many examples of when those things were not optimal, that our response was slowed and we could have done better. So, I mean, in the issue, I've had a couple of the students who are involved in studies of foreign service. I mean, if there is anything of a challenge that requires international cooperation, it's a pandemic, by the very definition of what a pandemic is.
All right, Dominic, thanks for the question and welcome to Georgetown. All right, next up, we've got Hunter Congdon. Hunter?
My name is Hunter Congdon. I'm a rising senior in the SFS at Georgetown, and I'm currently in New Haven, Connecticut. My question is, it seems like we still don't know whether having had the virus confers immunity. When will we find out that for sure? And will the answer to that question affect the vaccine? And could it mean you get more sick if you get the virus a second time?
Okay, good questions, Hunter. So we will not have the definitive answer to your question until we're out many months and a year or more to be able to definitively determine the durability. I think I could say with a degree of confidence that if you get infected and you recover, it was because your immune system and your immune response suppressed and ultimately eliminated the virus. So if you were infected, I could say confidently that you have immunity. What I can't tell you is how long that immunity is going to last. I would hope that it lasts a substantial period of time, but we don't know because we've only been involved in this outbreak for 5.5 to 6 months. Does that impact vaccination? It does. So what we're going to do is hope that when we do vaccinate individuals, that the vaccine would give protection that's at least long enough for one full seasonal cycle. Hopefully much more. But if it isn't, there's always the opportunity to give someone a booster. So that's the answer to your first two questions. The third question is that if you get infected before and then get infected again, could it make it worse? You're talking about what they called enhancement that's antibody induced. That's a phenomenon that we're studying now. I hope it won't be a big deal. there are some infections where pre-existing low-level inadequate immunity leads to an enhancement of infection. We've seen that with respiratory syncytial virus vaccine, with dengue, and we hope we don't see it with COVID. But that's the reason why when you do a vaccine trial, you pay a lot of attention to safety. So 3 good questions. Thanks.
All right. Thanks, Hunter. Next up, April Lenhart. Introduce yourself.
Hi, Dr. Fauci. My name is April Lenhart. I'm a graduate student at SSP. Thank you so much for being here today and discussing all these things with us. My question for you was, in a very contentious type of political climate, how do you bridge that divide between, on the one hand, the necessity to disseminate critical information about the seriousness of a disease, and on the other hand, the need for that advice to actually be accepted on both sides?
Yeah. Well, the most important thing to do is when you're dealing in what I think you're referring to as a divisive atmosphere in the country at whatever level you call it, is to stick to the science and stick to the evidence and avoid at all costs getting involved in any of the political, ideological divisiveness. If you want to get a message across, build up the confidence in others that you are speaking the truth and you are speaking and advising on the basis of evidence and science, because that's the thing that's clean and crystal clear. There's not, ideology involved. There's not political persuasion involved. Just stick with the data and use that to make whatever advice or recommendation you're going to do. And you can get past all of the other stuff that's unfortunately background noise and often gets in the way of what you're trying to do.
Okay, thanks, April. Next, let's go to Andrew Bialik. Andrew, go ahead and introduce yourself.
Good afternoon, Dr. Fauci. Thank you for being here. My name is Andrew Bialik. I'm a rising junior in the college studying government. I am from Long Island, New York. And my question has to do with a lot of the work that I do with the Georgetown Disability Alliance and mental health. How do people around the world, specifically students and parents with little children, reconcile the mental health component of going out and leaving quarantine and isolation with the risks that it might necessarily bring along with it?
Yeah, well, that's really a great question, Andrew. I'm glad you asked it. That is one of the reasons why it's a complicated situation. We need to contain the outbreak, and the kinds of confinements and physical distancing, shutting down, if you will, have played an important, successful role in getting cases down. But the reason why it's important to open the country again and to try to get back to some degree of normality, it's not only because of the inconvenience, it's not only because of the economic impact, people losing their jobs, but what you're talking about and what you're interested in, it's also important. The strain on the morale and the mental health of people being put in a really abnormal situation like lockdown is one of the things that you need to consider and balance. So you don't want to open up and create a big surge again that would cause you to take a step backwards. But on the other hand, you've always got to try in a good, prudent, careful way to get back to some form of normality. One reason of which is the point that you make. It does have a negative impact on everything from the health of kids getting checkups to mental health in general. So that's one of the things that we do consider. So thanks for that question.
All right, thanks, Andrew. All right, next up, we've got Quentin. Quentin, go ahead and introduce yourself.
Hi, Dr. Fauci. I'm a rising senior in Georgetown College. I'm also working as a contact tracer this summer. And I was wondering, what steps should policymakers consider to ensure that which country and which groups within that country get a deployable and effective vaccine first, that this does not magnify existing social and geopolitical inequalities? Thank you.
Well, Quentin, thank you for being a contact tracer. I applaud you for that. We need you. The idea about equities, not only in the distribution of vaccines and scarce therapies, but also in the clinical trials that determine if they work or not. You want equitable distribution because you want to make sure that community, we have community engagement, and we have a number of mechanisms of getting people together. People with underlying conditions. Hopefully you could quickly get everybody vaccinated or get the therapy to everybody who needs it. But sometimes you have to make difficult decisions. That's the reason why you want to go by the strongest medical and ethical principles to guide you.
Tony, this is John, just a quick follow-up. Could you just give us a couple of sentences on the state of vaccine development, just your projection, given where we are right now, when we're likely to have vaccines? Obviously, there's nothing guaranteed, but your sense of the likely timeline.
Well, we're on a good track, John, with some good news that's either coming out today or tomorrow, the publication of the phase 1 trial for one of those candidates that showed really good neutralizing antibodies, safe, no adverse events, but good levels of neutralizing antibodies in the vaccine. That's going to go into phase 3 at the end of this month, at the end of July. Then there are other candidates that will soon be following at the end of the summer, the early fall, mid-fall. So I think we're in a pretty good place when it comes to vaccines. I mean, obviously, you want to prove that it's safe and it's effective, but if things work out the way we hope they do, I think by the end of this year and the beginning of calendar year 2021, we will have enough information to know whether the candidates that we're dealing with are safe and effective. And hopefully, apropos of Quentin's question, we'll be able to distribute it in an equitable manner to a large number of people. So I'm cautiously quite optimistic about that.
Great. Thank you, Tony.
All right.
Thanks. And thanks to Quentin for the question. All right, next up, Dan Sachs. Go ahead.
Hi, I'm Dan Sachs. I'm an incoming first year to the college, and I'll be studying linguistics. And so the question I had was answered a little bit, but I wanted to take it to about the vaccines. When will it be released across the country and across the globe? And when should we expect to have a complete immunity and get over COVID-19?
Okay. Good group of questions, Dan. So, when you talk about when we'll be able to give it to everybody, that's assuming that my timetable is correct. And if it is, I think as we get into the year of 2021, the companies who are involved in making the vaccines promise that we'll have many doses to the tune of a couple of 100 million. If that's one company with a couple of 100 million, another company feels that within a year, they could have a few 100 million up to 1 billion. So right away, I'm feeling much better about getting vaccine that's distributed not only within our own country, but that they'll be able to have doses for people throughout the world who cannot afford, nor are they in a situation where it's very easy for them to get vaccinated. You should know that no vaccine is going to be 100% protective. What we hope is that with a combination of people having already been exposed and a vaccine that's anywhere from 70, 75% effective, that there will be enough herd immunity, that there will be a time, Dan, when you and I don't have to worry about getting infected with this awful virus that we're having to deal with. And I hope that that time will be reasonably soon. And when I say soon, I say within the next year to year and a half.
Okay, thanks, Dan. We're getting close to the end of our time, but I want to try to squeeze in a couple more student questions if possible. So next up, we've got Lauren. Lauren, go ahead and introduce yourself.
Hi, my name is Lauren. I'm a second-year student at Georgetown Law School. And my question is, do you believe that a comprehensive contact tracing program can be implemented on a national scale in a way that would evade widespread accusations about privacy violations?
Yes, I do, firmly. I mean, I believe if done properly, if done correctly, with people who are the contact tracers that are trustworthy and competent, I think that this can be done. Contact tracing is it's not the only part of epidemic and pandemic control, but it really is a very important part. It becomes much more important when you're in a containment mode as opposed to a mitigation mode. Because when you have such a wide outbreak at the community level, and you don't really know because you have so many asymptomatic carriers, contact tracing can be very problematic. But in the conditions where you have a low enough rate of infection, I think it can be done, Lauren, under the conditions where you're not going to worry about privacy issues.
Okay, thanks so much, Lauren. We are running out of time. So, Dr. Fauci, I want to ask one last question. And that is actually about our frontline workers. They, they're out there on the front lines, not only in healthcare settings, but in, grocery stores and transit and other essential industries. Are we doing enough to protect them? What steps should we take to protect them and their families, especially as this pandemic continues to unfold?
Well, I think one of the things was a question that one of the students asked about prioritization of essential workers with vaccines and with therapies. But I think what you would do, Mo, to protect them is what you would do to protect everybody. A broad feeling of messaging in a way that they do what's necessary to protect themselves and give them the resources to do it. Everybody should be wearing a mask when they're out, should be avoiding crowds, should keep distances, should be washing hands, should be doing the kind of almost obvious things that you need to do. If we did that, whether you're an essential person, a grocery person, a frontline worker, the chances are that you are not going to get infected. What we can do for people like the healthcare workers, we better make sure that they have the proper personal protective equipment. We should never be in a situation where people are putting themselves in harm's way to take care of others, and yet they're putting themselves at an unreasonable risk. So that's one definitive thing we can do. Make sure we have the resources and the equipment to protect people who are doing essential jobs for us.
Great, thank you.
Well, Tony, I think this hour has been unbelievably informative and I would say inspiring. Since the time I first met you, more years ago than I care to remember, you've really been an inspiration to all of us about what public service, health, and science mean. And I'm confident that our students really benefited from your message today. So thank you for all you have done and all you will be doing to help our country. And thanks again for your time. We really appreciate it.
Well, thank you, John. Thank you for having me. It's always a very enlightening and enjoyable experience dealing with you and with the students of Georgetown. So thanks for having me.
Take care, Tony. Thank you.
Care.